Welcome to the Sri Lankan Understanding, a platform on which we explore the past, present and potential for the future of Sri Lanka, an island in the Indian Ocean. Our topic for discussion today is the process of comprehending cancer in Sri Lanka, where it has started off, where it has gone, what potential do we have for the future in terms of finding a cure, looking at ways and means of dealing with cancer. To speak to us today, we have a guest who is a medical doctor by profession, having been associated with the World Health Organization. She's also the chairperson of the Indira Cancer Trust. Dr. Lanka Jayasuriya-Dissanayake, thank you so much for joining us on the program.
Thank you so much for the invitation.
If we were to start off and ask you, when did the international community first start realizing the rigors of cancer?
I think, George, the word cancer in itself, I think if we just go back to the history of cancer, I think although the word cancer was not used, it was something that was detected in the early ages. I mean, if you look at the Egyptian era where the mummies were found, they found lumps and unusual texture in the bone. And also if you look at the scriptures in terms of writings, the first case of cancer was basically written not as cancer, but something that was found which is incurable. And that was found about 3000 BC in that era. And that was 8 breast lumps that were found. The word carcinoma or carcinomatosis was first used by the father of medicine, Hippocrates, around 400 BC. So that's when the word cancer started, and the international community since then, when you go back to the 18th century, 19th century and the current era, it has evolved to what it is today. Where it's a very comprehensive disease. It's a disease that causes multiple issues, not in terms of only death, but also quality of life and also morbidity patterns. And it's also one of the highest diseases that causes death and morbidity worldwide as well as in Sri Lanka. So multitude of factors play into that. And if you look at the question that you asked, so we have evolved from the 3000 BC era up to the current era where the medicine, the prevention, the early detection, the management and diagnosis, and also in addition the palliative and supportive care has evolved globally into something that can actually, if detected early, we actually can get a complete cure.
When we look at our country, when did Sri Lanka first start detecting it and start doing research?
Yeah.
Obviously the research must have come before the treatment started.
Yes.
We must have realized that there were cases that were being found.
Yeah.
We did not understand what it was at that time. Where does this begin? Where does this process begin here?
I think Sri Lanka as an island nation, I think we have progressed a lot when it comes to our health. We have one of the strongest primary healthcare systems in the world, and we were the first country to set it up. In that context, if you look at the public health system and the curative system, we've had a strong system throughout within the Ministry of Health. The official launch of the National Cancer Control Program, which is basically the focal unit that is handling cancer, came about in the 1980s at the recommendation of the World Health Organization, where they recommended all countries to have a focal unit with a dedicated staff to initiate this public health problem, which is going to be a global problem as well as a rising problem for countries. So it was in the 1980s that a dedicated unit, 1980 actually, dedicated unit called the National Cancer Control Program was set up with a dedicated director, a deputy director general for non-communicable diseases and a dedicated staff. So within that program, they look at several areas. When you look at cancer, and research is absolutely, you're right, it's one of them. And they did operational research. So that means whatever they found, they used it for their policy decisions, and that's what we encourage countries to do. They also, through that, they also looked at primordial or primary prevention, then early detection, then management, diagnosis, and also we look at data. So that is also a priority area that the ministry has, because it is the data that generates evidence to affect, basically to formulate policy decisions within a country. So that is the history of Sri Lanka, and we are one of the strongest. I mean, if you look at the Southeast Asia also, Sri Lanka is one of the strongest areas, and also we are very proud that Sri Lanka has also been selected by WHO as a pact program for action on cancer therapy, a model site. There's also a lot of international collaborations with other UN organizations and other organizations. We have done that because of the strong ministerial support and the structure that they have set up.
So it's been over 4 decades now.
Yes.
So obviously a lot has taken place in this period of time. Yes. We've had dedicated hospitals being put up, we've had various campaigns being carried out. I know some of the cricketers have been involved in these efforts as well. And we are making a certain degree of progress from what you have indicated already. Definitely. When we return in the next segment, we'll be looking at where we are right now. What is the process? When we return with the next segment of the Sri Lankan Understanding. Welcome back to the Sri Lankan Understanding. We are in conversation with Dr. Lanka Jayasuriya-Dissanayake, and we're talking about the process of comprehending cancer in Sri Lanka. Before we went to the break, we talked about how it originated in the world, how it has gone back, as you mentioned, going back 3000 BC, a very significant period of time, and also what has been done in Sri Lanka. If we look at the current state of play, have we been able to clearly identify the cause for cancer, or is it still being viewed from a very general perspective? Is there a direct way that we can say X causes it? Is that possible?
Yes, it is. And I think we are very fortunate that we know there are 80%. Now, cancer falls under the category of non-communicable diseases. And if you look at the world and in Sri Lanka, about 80% of the deaths are because of non-communicable diseases. And from that proportion, about 12% are cancer. So we do have a significant number of deaths. We get about 23,000 people being diagnosed every year, and about 14,000 people die of cancer every year. So to reduce these numbers, we need to address the risk factors. And the fortunate thing is about 80% of these cancers are because of what you call modifiable risk factors. So there are 4 risk factors that is basically which you have to address. That is the healthy diet, physical exercises, tobacco and alcohol. So tobacco and alcohol are basically items which you are not supposed to. It increases your risk of any cancer, and also things like other diseases like heart diseases and stroke, things like that. And in addition, if you talk about the diet, now these are generic things which have come to us from global research, but also there's a lot of research that has been done in Sri Lanka which has highlighted these factors. So if you look at the diet now, our diet is very different to the Western diet, but in our diet there are common factors which we must reduce: the content of fat, the triglycerides, the saturated fats, the sugar content. So our diet, being an Asian diet, we tend to use a little bit more oil and so unhealthy. So there are ways to counteract that. So diet is a very important factor. And in terms of physical exercises, there are WHO recommendations of 30 minutes of physical exercises every day. So keeping your weight to an optimal weight according to your height is a must. So these are modifiable things which you can actually do something about. And there are things which you can't do anything about. One of these things could be a genetic composition. You get families where you have sisters. Mostly you see that a lot with breast cancers and ovarian cancers, where there's a genetic component that actually causes them to have it. Then there are other items, for example, like the use of the contraceptive pill. If a girl child attains menarche early and then attains menopause late, that means they're exposed to estrogens. So that also increases the risk. And one of the best things also, if you're breastfeeding actually protects women from breast cancer. I'm talking about breast cancer a lot because that's the commonest cancer in females. And in males, the commonest cancer is lung cancer and oral and lip cancer. So these are things, and that is mostly related to the tobacco. So risk factors, yes, they come from a generic pool of risk factors, but we do know, and it's closely related, and so we do know that there is a cause for cancer, which we can actually prevent if we kind of follow that lifestyle advice that is being given to us.
From a policy and treatment perspective at the moment, where do we stand?
I think again Sri Lanka stands way ahead of many countries, and a lot of credit goes to the Ministry of Health. Because at the moment, if you look at the Southeast Asian countries, Sri Lanka has followed, now it has a strategic plan, a policy document which highlights the strategic areas that the country should be focused on. And also if you look at the Sustainable Development Goals, we have a target for 2025 to reduce the premature death by non-communicable diseases by 30%. So those targets, to meet those targets, Sri Lanka has to have a plan, and we do. And because of the strength of the ministry, and also the strength there is that they have a multi-sectoral approach, because this is not something that a ministry alone can do. You need the private sector, you need the civil society, you need community-based organizations, and they developed a plan and they are implementing the plan. So in terms of, then they have a lot of emphasis have been placed on prevention. So all the lifestyle modifications and all that, they have placed a lot of emphasis on that, because that's the most cost-effective intervention which you can do. So there's a lot of advocacy for that. Then early detection is again another aspect, and in Sri Lanka we have 3 programs that basically the breast cancer, there's early detection program, for cervical cancer we have, and also for oral cancer. These are 3 top cancers. But something that we are seeing now with the numbers, if you look at the 2019 data for cancer, we seem to be getting a higher incidence of thyroid cancers, which is surprising. And that again is something where more research needs to be done, because the pattern is slightly changing for both males and females, where it's coming up to become the second highest, especially in the males. So those, and also guidelines in terms of management. If someone has cancer, whether they get treated in Colombo, Jaffna or Kandy, the treatment should be the same. The medicine should be available. So a lot of emphasis is being done by the ministry to make sure that the early detection and the treatment part is available in a very throughout the country. And they are setting up strong, there are 22 cancer units in the country, and they are also setting up basically peripheral units, at least in the provincial level, where it is similar to Apeksha Hospital, where all the facilities are available. So a lot of credit goes to the ministry for their effort, and Sri Lanka has stood high in the cancer prevention pathway that they have taken, and the management pathway, and the support that is being given by all the organization is also a lot of credit has to be given to that.
Very heartening and very positive to hear
Yes.
that something of this nature is being done, because it goes to prove that we have had the potential and we've taken action.
Yes.
And we are among some of the countries that are taking very credible action in terms of trying to improve the quality of life, as you mentioned,
Yes.
that being the most important thing. When we come back on our next segment, we're going to look at what more can be done. A lot has been done, but of course there's going to be a lot more that we can explore when we return on the next segment of the Sri Lankan Understanding. Welcome back to the Sri Lankan Understanding. We are in conversation with Dr Lanka Jayasuriya-Dissanayake in understanding the process of cancer in Sri Lanka, how it has been responded to, and what we can do at present. When we look at yourself, you have experienced this very close in your own family. Your sister passed away a few years ago, and she was in the UK at the time. Could you tell us more about her?
Yes. Actually, she's the reason that her passing away was the reason that I left the World Health Organization. I was working as the focal point for non-communicable diseases. Her story was actually something that was carried a lot in UK and also in Sri Lanka, because she was diagnosed with breast cancer in 2008. She didn't have any children then. She fought it, and she fought it so bravely. She worked every single day, she wore a wig, there was no difference to her lifestyle, and she was cured. So in 2011 she had her first child, a daughter, and then and she was being followed up. And then she was pregnant with the second child, and in 2014. And that's when she was admitted to hospital about 27 times during her pregnancy. And then suddenly with a scan they found out that the breast cancer had come back, and worst of all, it had spread all over. So that hearing that news was devastating, because it's not something that she expected. But she took the news and she said she wanted to carry on with the pregnancy and then think of treatment afterwards. So her decision, we all respected her decision, although it puts her life at risk. So she went through the pregnancy. She had a healthy baby boy in May 2015, and then she started her chemotherapy. So by that time her cancer had spread quite a lot, but she took the chemotherapy, she again fought, she did a lot of, she was very positive. And actually the end was basically 1 year later, when the baby was 1 year later. Then suddenly after a few weeks she was admitted to hospital and she passed away. She was unconscious for about a week. This was in UK, and I flew down there from Colombo, and my father was in Geneva attending a meeting and he flew down. So by the time I went, she was talking, but by the time my father came, she was just going into her unconscious state. But she was very comfortable. That's what initiated. It was actually my father who was, we were all there as a family, 7 days. We were holding her hand, we were there, but she was extremely comfortable. She didn't have any pain. She had a dignified end, which is what every human being should have. And that prompted my father, actually the support we got as a family. You know, we get asked whether we are okay, you know, anything is needed, the empathy, the kindness. So that prompted my father to start an organization, which I think 5 years later has become to what it is today. I mean, we are so happy that we are able to support, and we have evolved. We have always worked with the government, the private sector, the other civil organizations, and made sure that what we provide is not duplicating, and we provide and we support the gaps in the system. And we place a lot of emphasis on the quality of life, because cancer, unlike any other diagnosis, unfortunately seems to have a very negative effect on people. So it's, I mean, if you say you have diabetes, people treat that differently to when you're told that you have cancer. It shouldn't be the case. I think that's where we have developed, we have over 20 programs to support patients, to support families. I mean, it ranges from financial support, emotional support, spiritual support. We also run a helpline for patients. We help the children's educations. So that has come about with the experience we have had, so that if anyone has cancer, there's always a place to go to, a phone call to make. You know, we are always there. I think that's very important. And also the comfort and the quality of life of a person is extremely important. So that is something we place a lot of emphasis on, and we support that. And also the strength of the organization. I think today we do over 20 programs. We have also a volunteer force of about 600. And we have a core team of staff and what we call coordinators. And they have made it their personal journey. So this is a personal journey for all of us. If you speak to the core team at the trust, we all have a story to say. So we understand what the other person is going through, and it's not easy. But it's something that you can get through. It's for a short time, you can get through it. And we are always there to help. So that is a message that we want to give out, and to say that, you know, cancer is not the end of the world. There is a world out there. So just until you get there, we are always there to support you.
Precisely. That's a very important point, having that support base. Yeah. As you said, you saw it personally because of people reaching out to you, and obviously it's very important to be there for others as well. Going through a very difficult time from the time of diagnosis, and you're not sure, the reports have to come in, you don't know what the results are going to be. You might hear something very alarming, you might hear something that can be treated, but dealing with it, you have to accept it at some point. Yeah. This is not something that you can suddenly pluck out of your system. And there are various stages at which it could be detected as well. The earlier the better, but if it's a later stage, it's got to be dealt with at that particular point. Going forward, you mentioned a lot has been done. We have taken very stringent policies very early on, 1980. But what more can we do? Because obviously it's quite clear that when we look at countries around the world, not to do a comparison with some of the more developed ones, but in terms of looking at care, quality of life, what more can we do in order to respond to such situations?
I think if you look at the spectrum of cancer, I think prevention part we are doing a lot, with campaigns. Early detection also we can do a lot more, I think we are doing. But for example, having specific, for example, in terms of strengthening the health system, getting the relevant diagnostic equipment throughout to the remaining country. We don't want only Colombo to be the hub, we want the hubs, and that's the plan of the ministry anyway. For example, if you have breast cancer, if there's a lump, they should be able to go and get a mammogram or ultrasound. So those facilities need to be done, and there is a plan from the ministry to do that. And also we had to look at the profile of the cancers that are there, and like what I mentioned earlier, thyroid cancers, the numbers seem to be going up. Then looking at the management in terms of treatment, we have guidelines, so we know exactly what medicines need to be used for this particular cancer. We know how to stage it, we know all that is available, and that again is a strength of the country. But again, treatment has to be available throughout the country. So the plan of the Ministry of setting up and strengthening the provincial level units is a great initiative, and that's ongoing, and that will hopefully enhance this effect and make everything available. The treatment part, then we go on to one of the most important parts, which is the quality of life and also palliative care. Now we talk of palliative care when we seem to associate palliative care with death. It's not like that. Palliative care starts from the time of diagnosis, and it doesn't mean that they are going to die, but they may. But we make the quality of life the priority in the palliative care setup. So that again, Sri Lanka has now we have actually moved forward. We are talking of adult palliative care, we are talking of pediatric palliative care, and as Indira Cancer Trust, we are so proud that we have been able to support the national effort by setting up Sri Lanka's first pediatric palliative care center. So we are setting it up just next to the Maharagama Hospital, and there are other organizations also who are doing adult palliative care. So with that, I think quality of life component comes into play. We look at all aspects of life. So that is again an area where we need to strengthen a bit more in the future, and it's happening as well at the moment. And with cancer, another aspect is the social aspect. And I know at Apeksha Hospital, which is the leading hospital for cancer in Sri Lanka, there's a close connection with the social services department, where the welfare part is also looked after. So I think strengthening the multi-sectoral approach to cancer care management and treatment is anyway ongoing, but that again is something which you can strengthen and then take things more forward. And I think we will get there where there's a lot of commitment. I think if you look at the professionals, we have very strong professionals in the field of oncology, in the field of surgery, and they have made it their mission to also strengthen the services and support the Ministry of Health and other organizations working in Sri Lanka to combat cancer. And not only, and also one thing we must remember is we talk about statistics, we talk about numbers. Behind each number there is a story. So, make some time to listen to that story. I think compassion, kindness, empathy, but not sympathy. Cancer does not evoke sympathy. So these are things, we always say a kind word. These are things that doesn't take any money. It just takes a little bit of effort from your part, and you can do something for a patient with cancer or someone diagnosed or a family member. And it's something that you yourself as an individual can do. You don't need to be out there. If you see someone with, talk to them and encourage them, and it's not the end of the world, and there are enough services available for them to take them through that journey of a few months of, combating the disease.
Kudos to you and the trust for the work that you have done. Your father has set up a wonderful institution which is actually making a difference in the lives of people, and that is the most important thing at the end of the day. Because when we look at our country, when we go around the country, we are very fortunate in a way that people have access to basic medical facilities wherever you are in the country. There are certain countries in our neighborhood, beyond it, where people have to go miles to access basic medical care. But as you said, reaching that much further, strengthening what we have in the periphery, this is going to be something very important in the years ahead, because people are still traveling to Maharagama, people are still traveling to the main areas. That itself is energy sapping.
Yes.
When they have to undertake that journey, they must be just thinking, no, I just stay at home, I can't make this journey, it's just too tiring for me to do that. How am I going to travel? Transportation, costs involved. These are things that we have to probably address in the future as well, and also look at that most important thing of learning to deal with the situation at that point, understanding it, empathizing with people. As you said, the most important word there being empathy, and not just merely feeling sorry for someone. That's not what the objective should be. But this is where we can do things, we should be doing things, and this is where we should be taking this forward. Thank you so much for joining us on the program today, and that was the end of this episode of the Sri Lankan Understanding. Join us next time when we explore another aspect of this island nation. Look at the past, look at where we are right now, and look at the potential for the future.